Hello, this is Dr. Gay from First Look MRI, and this is a 29-year-old male who injured his knee about 3 months ago, had an ACL sprain, and the pain got better at first, and then now it's come back and he has some stiffness. And on this sagittal view, we see in the profile, we see the kneecap on the left, the femur, the big thigh bone up here. We see the tibia down below to get oriented. This is the back of the knee, the popliteal region. And we see the anterior cruciate ligament goes obliquely through here. And the main finding is that the ACL is not well seen. He had a prior sprain, and on other views we can see the ACL look like it was intact, but it's not quite normal. We don't see the fibers very well, and we do see something extra. There's a glob of lobulated intermediate to low signal here in the midline knee joint. It obscures the ACL, protrudes anteriorly, and you can see how the knee, if the tibia wants to go forward here to go to full extension, this is in the way. So this may limit full knee extension. And this is something we call arthrofibrosis, and it's scarring or a fibrotic response, some collagen and scar tissue laid down in patients typically who have had an ACL repair. That's where we see this most often. So if they have an ACL repair, we see this glob, and they think it may be related to some of the ACL fibers that are torn, having an inflammatory response or scarring around those. In this patient, there has been no ACL repair, so it's a little bit unusual, but you can still get this in patients who have had meniscus tears or prior injury, or even people who have osteoarthritis can sometimes develop this. But this is an example of arthrofibrosis, a glob of inflammation here in the central knee, or fibrosis, scarring. We see it here. It looks rounded or bulbous on this axial view, right here in the middle of the knee. The white is fluid that's surrounding this process. And this patient also had a tear of the medial meniscus. There's a really subtle oblique line here. This is a meniscus tear that's almost completely healed. You can barely see the remnants of it. If we do another MRI, I bet that'll be even harder to see on the medial side. They also had a tear of the lateral side that was worse. This is a sagittal view. We see the front of the lateral meniscus, a little black triangle fitting between the femur and the flat tibial shelf here. We see the anterior horn of this lateral meniscus, and the posterior horn should look like a mirror image, but instead it's half the size or smaller, and there's a vertical band of brightness here. That's a longitudinal tear right within the posterior horn. So the patient has a longitudinal tear in the posterior horn of the meniscus, and this big glob, arthrofibrosis, associated with a partial tear of the anterior cruciate ligament, and also there's some fluid here in the front of the knee. Thank you very much.